guys, welcome back to my YouTube channel. Today I just want you to pay close attention because I'm going to open up an aspect of my life I've not really talked about on the channel with the person involved. I've been talking about it, but I've never brought the person I've been talking about. So today I have with me one of the best psychologists I've ever met in my life.
I'm stretching it.
No, it's the truth, it's true. So I'll let her introduce herself to you guys. Okay, so Auntie May, do you want to introduce yourself?
Okay, my name is Dr. May Cullen Wulff-Caesar. I am a consultant clinical psychologist. I work at Equilinks Counselling, CEO of Equilinks Counselling, and I'm also representative for the Ghana Psychological Association.
Yes, she's many things. She's also a mother, a wife, a sister, an auntie. She's the best of the best of the best. So please subscribe and share this video with all your friends, family members, so that a lot of people will get to understand that psychologists are very important and they make a whole lot of difference in our lives. In 2015, when I was experiencing symptoms of bipolar disorder, my family and I, we had no idea. In fact, we started, especially my mom and I, we were going from church to church trying to find solution to whatever was going on, because some pastors said I was being spiritually attacked. So I remember this one day, my parents took me for a drive in their car, and my mom was telling my father that she had seen the signboard of a psychologist in our area. And I couldn't believe it because me myself, I had never seen that signboard she was talking about. So we were driving around, and then we came to this house, a very beautiful house. And my father just stopped the car and rushed into the house. And my mom and I were sitting in the car waiting for him. Me, I didn't know what was going on. It's like I was there, but I wasn't really there. And mind you, I had already seen a psychologist and a psychiatrist, and I wasn't really happy with their service because it looked like I was just another patient, another number. I come, they give my medication, I go. We don't really have that kind of relationship. And this was very hard for me to accept because at the time, they said I had schizophrenia. So it was tough for me to accept. I was in denial and all of that. So when my father rushed into the house, he came outside with this beautiful woman. And when I saw her, the first thing I noticed was her beauty. I was like, wow, this woman is extremely beautiful. Like, I'm not exaggerating. Even though I wasn't mentally okay, that at least I could recognize beauty.
I think that was right.
So my dad comes out and then you also come out. So that day, how was that? Do you remember that particular day?
Oh, I remember it so well, but I am hoping that I'm covered because this is confidential.
Yes.
You're giving your consent for me to know.
Yes.
Oh,
I've given my consent. Everything.
all signed. Okay.
Yes.
As I remember, I was out here.
Yeah. In 2015.
So I saw signs. You know, we have in schizophrenia we have positive symptoms, we have negative symptoms, and I saw fewer positive symptoms.
Oh, okay.
We see positive symptoms that indicate that there is, this disorder, but you seem to be exhibiting more of bipolar. Okay, so of course I talked to your parents a bit, some more history about the condition, how long you've had it, frequency, severity, and all that. These are things that are important to us. And from what they told me, I started to believe that we were looking more at bipolar, which is still another psychotic disorder, but we're looking more at bipolar than schizophrenia. And of course, some of the symptoms are pretty similar.
Yeah.
So it's one of the differential diagnoses that we make. That you seem, like I said, to exhibit more symptoms of bipolar than schizophrenia.
Yeah. And even me, I don't think at the time I really knew what schizophrenia was about. I just heard the doctor tell my parents. I didn't really know what was going on with me. And I remember that day, I didn't know that day would mark a turning point in my road to recovery, because in the car that day, all I could think about was my life is over, my life has ended. One day I'm going to be on the streets, I'll not be able to graduate, and people will see me and say, oh, do you remember this girl? She was in University of Ghana and she has lost her mind. All I could think about was doom, death sentence, my life is over. So when you came and brought me, it was this very room, I remember. Now, if this room could talk, it will show you guys pictures and videos of how I feel like I looked disheveled that day. I was just a mess. I felt shabby within and out. So when we came here and I was talking with you, I didn't even think anything could be done about my situation. But you were very optimistic, very hopeful. Say, hey, this woman, is she seeing something I'm not seeing? I mean, I don't know. Why were you so hopeful and positive about my situation?
Well, even though you were down, I listened to you. I remember what you said that happened prior. You know, I still recall very vividly.
You have a very good memory.
What you said had happened to trigger
everything.
So it was based on that, and of course you're observing the person's behaviors as well. So, like I said, you were exhibiting more of the PD, bipolar behaviors, and so I knew that with the right medication and the right attention paid to you, and of course with some psychoeducation, so that you can understand, you know, that you would have these lows, you would have the highs, you'd be able to manage yourself. And also because many times when people get into that depressed state or the manic state, which usually is when they engage in a lot of activities that they regret later. The downward, they spiral faster.
Yes.
Okay, so once you understand that this is what's going on, it kind of like puts the brakes on. And I thought you needed to know that. That would give you hope. Like, okay, I'm going to have good days. I'm not getting mad. I'm not going mad. But I am probably going through what is a manic phase, and it will pass. You know, and so you would be able to go on with your schooling. You would be able to graduate. For me, that was important. That once people know that it's not a death sentence, it's not like your life is over. Once you know what's going on, you see, the knowledge is always power. And then when you are forewarned, you're in a way forewarned. So then you know what to expect. You can say, you know, I'm down. And you know it will have been a few days or in a week, I will start to come back up. Otherwise, when you're in the down and you don't know that you will come back, then you might have the thoughts of, let me just end it all. So I wish more people would know that we do come out of it. So that's what I saw. Those were the signs I saw.
And me, I remember I used to ask you a lot of questions back then, and what I loved about you and still love about you is you didn't make me feel like I was crazy. I was asking too many questions, because you've seen me in my manic state. And even when I'm manic, and I remember one day I rode a bicycle from my house to this place. And if you ask me why I rode a bicycle, I don't even know why. But when I came here, I know I was talking a lot. I don't even remember what I was saying. But you treated me like it's normal essay, she's fine. You treated me very well, and then later when I came out of the episode, I think we had a conversation about it, and you've always been like that. I know your training is past, but I personally think your personality, like this is the job that you were called to do. You are such a
I like to think so too.
Oh, it is. You are such an active listener, and you're always there for me, and you've seen me through my worst times and my good times. So one other question I would like to ask you is that, are you surprised that I have turned out so well, or you just knew I'll turn out well? Because the reason why I'm asking these questions, when you finally referred me to Dr. Jima and I started the medication, I wasn't compliant. That one I've said it everywhere. I wasn't compliant, and he used to tell me, "Oh, it's like malaria. You take your medication consistently, you'll be fine. But if you don't take it, the malaria will come back and come back harder." So that 1 year from 2015 to 2016, when I was not compliant, were you ever worried that like maybe I'll never be well?
When you have a client or a patient call you when they are in a crisis, it is a good sign.
Oh, really?
It is a good sign. It means they haven't quite given up. It's like they know there's this last straw that they can crush, they can hold on to. You know what I mean? So if even in that moment, in that time when everything is going bad for you, you still pick up the phone and call. It means, or you send a text message. It doesn't matter what you put in the text message. It just tells you, okay, you're reaching out. Reaching out just means that help. I don't want to go down. So once you're willing to work at it, once you are asking for help, then there's a future for you. And we've always been, I remember all the friends.
Yeah, the boyfriends, everybody.
And writing your exams and needing to go out of the country to school. And I could tell that this girl, she really wants to make her life. It's just that disorder brings her down sometimes. So it's good for people to understand that, yes, if you are not compliant, your down days might be longer, your manic days might be longer, the phases in between might be shorter. So it's always good to comply, even if you don't want to, because you see, when you're taking the meds and you're in a good place, you're asking yourself, I'm fine, I'm really, really fine. I've had a lot of clients over the years tell me, I stopped. I stopped. You don't get angry with a client who has stopped taking their medications, because let's be honest with ourselves. Even when we are supposed to take paracetamol when we have malaria, it clearly states on the envelope, take 2 tablets 4 times daily, right? Whether you have the pain or not. But then if the body pays that to go away and I'll take 2, why should I bother again? I don't have the pain. So we even do that. So recognizing that the individual who does have a challenge, we find it even harder to comply. So we just coax you small. And so you haven't let me down. You haven't let yourself down. I'm so proud of you. Every time I hear about you and I see you, I'm like, whoa.
Thank you. Thank you. I remember one time I came here and I told you that the reason this time I was in level 300, I came home for Christmas vacation and I told you that the reason why I wasn't taking the medication was because I wanted to have insomnia so that I could stay up late and learn, which was, it didn't make sense because as I was staying up, I couldn't even learn. What I was learning, I wasn't understanding. And I think when you even reprimanded me on that, I took it like, oh yes, I'll listen to this lady, but I went back and I was back on the non-compliance. So I don't know what kind of hope you had, but even me, I didn't really trust myself like that. So 1 year later, I realized, you know what, we have done this without the medication so far. I failed 3 courses. My friends don't like me anymore. I'm in debt and all of that. So let me just believe what you are saying. And actually it was true. When I was in Benin, I realized, now I sleep well. I'm not fighting with anybody. I have peace. So you were not lying to me, because all this while I used to have this negative thought that told me, it's your job to convince me to take the medication, because maybe that's what you were taught in school to do. So I realized, you actually wanted the best for me.
And you were good. You would remember a couple of times you would ask if this behavior that you had exhibited was right. So it's fine. It's fine. Otherwise, you find that you're a bit too hard on yourself. When certain behaviors are normal, you start to think maybe you're overdoing it.
Yeah.
And so with BPD, it's also good to know that we get angry. We get angry, we get sad. It doesn't. So if you have BPD and you're getting angry, it's not a sign that you're relapsing. If somebody did something to make you angry, of course, it's a normal emotion to yes express. So we should also not be so hard on ourselves when we're dealing with a disorder.
I will never forget that conversation I had with you, because this issue happened in Benin and someone hurt my feelings and I got angry. So, later on I came and asked you that, because sometimes when you have bipolar disorder, you think everything you do is based on the condition, but you made me realize that I'm also a human being first, and things will happen. I shouldn't always think that because I was angry I'm manic. Yeah. So I was glad that I have you in my life and still have you as a powerful resource that I can talk to anytime, any day. And thank you for believing in me, because I remember one time you told me that one day I was going to be fine, I'll help people. I don't know if you remember.
I remember.
And I was looking at you like, are you sure?
You would be there, you would speak out for people. Yes. I don't know why, I just felt it.
Yeah.
You had what it takes to be a good advocate for mental health.
Well, when you said that, I said, this one, I don't believe it. I don't believe it. And years later, I'm like, this is the very thing you told me that I'll be doing. And I'm really glad that it's not even because of what you said that I started. It's just just started advocating and I realized, wow, this is what Auntie May was talking about, that I'll be helping people. And I am so glad that I'm still doing this, and you're also still being a good psychologist. I mean, Auntie May, she's very big, but she's just trying to be humble. And she's a huge fashionista. Like, Auntie May can dress. Auntie May, like, I
it's
guess
okay.
It's true.
This interview is about.
Is it?
This interview is about something.
Yes. Yes. So I also remember that day I met you at Junction Mall.
Mm-hmm.
That day I was going to meet my friends for lunch. So I had dressed up, not my usual dressing, but I just decided to sometimes switch things up. And even when I was leaving the house, I was like, am I sure I dress like this because I'm well or because I'm manic? So I got there and I saw, it was like I was on a runway. I knew everybody was looking at me, but what could I do? Then I saw you, and when we spoke, I felt, I'm okay, like I'm fine. And you made me feel good about myself too, like, wow, you look good and all of that. It was very...
Because in front of the bank.
Yes, you were the one. She was part of the people watching me on the runway. So every time I talk to you, it just makes me feel like, oh yeah, I'm fine. I'm not always going to see you when I'm sick or when I'm down. We can still have a very good relationship regardless of what brought us together. And I want to thank. I always say one day I'll surprise you.
You have to.
I'll surprise you. I'll surprise you in a very good way. I'm trying my best all the time, and my family, we are always grateful to you, because I know things would have been worse if you were not in my life. Who knows? Maybe I would have been in denial for 5 years or something. Yeah, so I'm grateful to you. So, what would you tell anybody who is struggling to accept their mental health status? Maybe they've been diagnosed and they don't want to, it's very hard to accept that this is what it has come to. What would you tell someone like that?
Oh, usually I break it down this way. We get a diagnosis of diabetes or hypertension, right? And of course it's disheartening the first time you hear that you are diabetic, or yes, you're above 6 or 9, and it can be scary. But then you immediately start to put things in place, right? this is a lifelong condition that you have acquired. What you'll be doing is managing it. And it doesn't mean that it's the end of your life. It just means that you make some lifestyle changes. You adapt to the situation. Because you see, the diabetes, hypertension, they are all actually controlled by hormones. Hormones that are released. Same way with mental illness. Hormones released from the same place, right? But because of stigma attached to mental health, we're less inclined to talk about our mental health conditions. We're more comfortable saying I have diabetes or I have hypertension. I tell people it's the same thing. You can manage it. You can. Okay? Especially when I have students, I tell them, you're not going to sit down to study when you're in the manic phase. It'll be difficult because you want to be up and about, you have all these ideas, these business ideas you have, or party ideas you have, you're throwing the best party ever, all these plans you have. So you're not going to sit and study. But we can utilize the down, where you don't want to talk to anybody, where you don't want to go outside of your room, you don't even want to take a shower. Maybe then you can just watch a video. And I encourage people to. There's everything on YouTube these days. Everything on YouTube. For 5 minutes, 4 minutes, and you will walk away, or you get out of bed with a sense of having accomplished something. I wasn't just lying in bed. I read something on economics today, or I watched a video on something, and knowing that your day was not wasted is what helps. So tomorrow again, you spend another 5 minutes browsing a topic, and because you lack motivation and that kind of thing, you're dispirited in the down phase, don't push yourself too much. Limit yourself. The thing is the awareness, the self-awareness I was talking about. I said knowledge is power. So you know what's going on. You're forearmed with the knowledge. So I can only do so much, and I'll do it. In the money phase, I'll go and do whatever that I want to do. But you see, if you're complying with your medications, then of course the behaviors will not be that extreme. But let's not give up when a loved one is given a diagnosis of bipolar. It's not the end of the world. So many wonderful people achieve great things because they had bipolar, because they could go into that manic state and they come up with all these ideas that would all be afraid, of even entertaining. But they would, and they would move with it, Yes. So my two favorite clients are those with BPD and DPD. Bipolar and borderline personality disorder. Because when they come up with ideas, sometimes I tell them, go for it.
Wow.
Go for it. Yes, but just let's make sure that we have a goal. Because when we are in the manic phase, we can throw this brilliant idea down the toilet. We can flush it down the toilet. So just write down your brilliant idea. And wait.
And come out.
Exactly. Because you don't know whether it will pan out.
That's true. So it can be a blessing sometimes.
Yes. Although many people who have it will not see it like that. But if you take it as, okay, this is what I have. This is what I got. I'm going to make the most of it. I'm going to make the most of it. That somebody with diabetes would feel that, yeah, this is it for me. I can't take sugar again. But that's not really true. You can. But then in moderation. So that's why we talk about lifestyle changes. It's the same with having bipolar disorder. You take the medications, the same with the person with diabetes will be on the metformin or whatever, just to keep the, sugar levels down. Try to see it that way. And I have a condition that is controlled by neurotransmitters or hormones. So I have to be on my medication. I take my blood pressure medication every day. You know what I mean? I'm very good, especially when I know I'm going to get very, very stressed out. I need to be on it. So I encourage clients to do the same. Take your medications, even if you feel on top of the world. Take your medication.
It's the best advice I've received. It makes a whole lot of difference. So guys, you can see that Auntie May is very, very special to me, and I'll encourage anybody. There's a mistake a lot of people with lived experience with mental health conditions do. They focus more on their psychiatry. They only see their psychiatrist. They don't also see psychologists. And it's very important to get a psychologist you are seeing. It really helps. So please, if you don't have a psychologist, please come to Equilinks. if you are in Accra, Ghana, or look for one, because it will make a lot of difference in your life. Yes. So please do. Auntie May, thank you so much for coming on the channel, and I hope this will not be the last time. You will come again.
I will. When you invite me, I'll come again.
Okay. Thank you guys for watching. Please make sure that you like this video and share with everybody. Thank you so much. Bye.